It's time for our Ask the Doctor segment. You send us the questions and we get the answers from the doctor for you right here on air. And of course, Dr. Caitlin Merkin, a surgeon with Mercy Bariatric and General Surgery, joining us as always for the segment. And we're going to dive right in. Nancy has a big question. She admits that she's immune compromised and had her last Pfizer COVID vaccination in May of 2023. So she wants to know, when should she get another vaccine? Is there a place to find more information about that?
Sure. If you're immunocompromised, you definitely want to make sure that you at least have one of the newest vaccines the 23, 24 variants out. After that, there's not real clear guidelines on what exactly you should be doing, but experts kind of agree that maybe every 6 months you should get a new vaccine. A good place to look is the CDC website, and of course to talk to your own personal doctor about your unique individual case.
Something we've had several viewers reach out to us over the last couple of months is tinnitus. And Patrick is messaging in, wants to know, what is the cure for this, or is there one at all?
Oh, Patrick, you're going to be disappointed. There's not really a cure for tinnitus. The best treatment strategy is to treat the source if there is one that's identifiable. Often this is due to hearing loss. So sometimes you can't actually treat the tinnitus or cure it, but you can reduce symptoms by things like getting a hearing aid. There's certain behavioral therapies that may be helpful, or sound therapies that can sometimes help.
Kathy taking the time to reach out to Dr. Merkin. She says she's a senior and wants to know what she can do to get rid of abdominal fat. What veggies would help with that?
Sure. So the best thing to target abdominal fat is actually to target fat overall. To maintain a healthy weight and to maintain a healthy, active lifestyle, you're going to want to strive for a healthy diet, things high in vegetables and fruits, high in protein, whole grains. You're going to strive for 150 minutes of exercise a week if you can, but just trying to maintain a healthy lifestyle is the best thing for you.
I think a lot of us get in the mindset that we have to work out so much every day in order to see the results we want, and really a lot of it does come down to diet like you're talking about. We want to talk about a study that we saw earlier. This was from a report about the Canadian wildfires drifting south again, that smoke like it did last summer. It's not in our area right now, but we do want to bring up, what are the health risks that smoke poses?
So this primarily targets our respiratory system, but also any sort of mucous membranes. So eye irritation and respiratory irritation is what we're looking at. If you have conditions like asthma, COPD, or heart disease, you're going to want to try to stay inside if our air quality gets bad.
This last one sounds like a concerned mom. Mary says her teenagers love soda. She's worried about the amount of caffeine they're consuming. What's the danger there? What is the max caffeine teenagers should have in a day?
Yeah, so caffeine is a stimulant. It causes a lot of things like accelerated heart rate, blood pressure, anxiety, agitation, can negatively impact your sleep. Things that teenagers kind of struggle with at baseline because they're growing. The American Academy of Pediatrics actually recommends that you avoid caffeine if you're a teenager, but if you're going to have some, they recommend a max of 100 milligrams a day. There's about 100 in 1 cup of 8-ounce cup of coffee, or there's about 30 to 40 in a can of soda.
I was going to say, I start every day with a cup of coffee now as a new parent, so I hit that limit faster than I used to. Yeah, maybe you do too. Want to say thank you for Dr. Merkin joining us, and if you have a question for her, just go to our website and submit your questions to firstalertfor.com/askthedoctor. Maybe we'll have your question on air when she visits next time.